to this afternoon's webinar. On your screen, you will see our very own Andrea, who will assist us with the logistics of this afternoon's webinar. At the very bottom, you will see Nicholas, who has actually got a promotion. Let me tell you, he is now our business development manager. So we're very excited for Nick. But our guest of honor, if I can put it that way, is Ljubica Petrov, right in the middle of your screen. And today we're going to be talking about effective communication, basically for multicultural audiences in aged care. And this is something that Ljubica is very passionate about. And we were just, before we came on air, we were kind of reminiscing, you know, about how long we've been around and who knows what and what's changed. And we came to a conclusion that not very much, and there are still many, many challenges and many issues that we are encountering as a community, as aged care service providers, as service providers. But let me just very briefly firstly introduce us. So many of you will know who I am. So I'm a director at Polaron. I still do a little bit of interpreting and translating in Polish, in the Polish language. Nicholas, I've introduced to you so we can move on. But the main guest of honor today is Ljubica Petrov, and I've known Ljubica for more than 20 years now, I think, and we've done many projects together. She has now, as of the beginning of this year, set up her own company, which I'm very excited about because I know she has a lot of knowledge and a lot to share. So she started her career in education and then very quickly moved into aged care with particular focus on multicultural communication. And currently, Ljubica is the director of Inclusive Services Australia. She has done a lot of consultancy work over the years, you know, including for Polaron. We've done glossaries of terms together, translations together. We've watched Ljubica being really innovative and progressive in how Ljubica sees the issues, the challenges, and how I think personally how she overcomes them. So let's move on very quickly through a couple of slides there. That's us. We do translating, interpreting, language services. We co-design our language services with community. This is our 20th year. So in November of this year, all going well, we're going to have a massive party with lots of champagne and canapes, hopefully. Otherwise, we're going to meet on Zoom like we are today. And I'll just ask Andrea to move on to the next slide. And I've talked about what we do already. But for those of you that are kind of new to us and what we do, we are very, very, very passionate about connecting the communities. We're passionate about creating communication that's relevant, that's useful, that's honest and transparent. We work with communities, with ethno-specific community organizations, with interpreters, translators, to deliver messages that work for the communities. So moving on to the next slide, I will now hand over to our wonderful Ljubica. Over to you, our very special guest.
Thank you, Eva, and thank you, Polaron, for this invitation. Before I start, I'd like to acknowledge and pay my respects to the traditional owners on whose land I live and work. And in these troubling times in Victoria, I would like to acknowledge the hardship that many families, residents, and communities and staff in aged care services are going through today. So in today's, I've been asked by Eva to explore some of the challenges and some ideas as to how communication can be improved with people from culturally and linguistically diverse backgrounds in residential aged care or in aged care sector. So next slide. So what I will hopefully cover very quickly is I will look at prevalence of languages other than English and the data that's available in residential aged care, communication challenges in residential aged care, role of language services and bilingual staff, and some of the issues that have become evident in relation to effective communication in this time of the pandemic. So next slide. At the end of the presentation, I have referenced the paper from which I have obtained this data so that people who are watching can access the full report. But in 2015, there were over 31,000 people who were born in non-English speaking country, and many of them would prefer to speak a language other than English. This is in residential aged care. Most people, of course, are in New South Wales and Victoria, and the dispersion of those people throughout the aged care sector is very similar in those two states. Then, of course, the numbers drop greatly for the rest of Australia. The slide also shows the utilisation rates of residential aged care services by people who were born in countries where English is not spoken, and you can see that there is a slight underutilisation. However, if we look at home care, there is an overutilization. So it all kind of evens out, or even, you know, I would say for many states, there is no ultimate underutilization of aged care services by people who prefer to speak languages other than English. Next slide. So, 20 top languages spoken in residential aged care facilities in Australia are provided in that list. And we can see that by far, most people speak the main two languages, Italian and Greek. And on the wheel to the right, you can see that more than 50% of people speak those two languages. So I sometimes say, let's just get those two languages right. We know that most speak Italian and Greek. All of the other over 100 languages are spoken by less than 50% of the balance of the people. So the challenge is great. This morning on the news, I heard somebody from Brimbank Council speak on the radio, and they said they have translated information about COVID into 60 languages, yet in their community, there are over 130 languages. So the language diversity is huge, especially in large cities such as Melbourne and Sydney. Next. Quite often people, when we talk about aged care services and elderly people who speak languages other than English, what seems to come to people's minds straight away are ethno-specific services. Services that are run by that are predominantly community-based or not-for-profit aged care services. However, in Victoria, 72.4% of aged care facilities have at least one speaker who speaks a language other than English. So they're not in ethno-specific services, they're in all 72% of our services. And I would say in Melbourne, it would be 100% of aged care services that have people who speak languages other than English. And in the western suburbs and the northern suburbs of Melbourne, and I'm sure that there are suburbs across Australia in the main cities, there are situations where most people speak a language other than English. 80% of speakers of less common languages are the sole speakers of that language in their facility. That has huge implications in relation to finding a staff member who might speak, say, Lithuanian, getting an interpreter, having social contact, and so on. So the challenges are huge. But I think that whether you have one person in your service who speaks a language other than English or many, issues of communication through the policies and so on need to be addressed. Next slide. So I just want to say that there is the community visitor scheme, and that is providing many isolated elderly, both in home care and residential care, with visitors who speak their language, and that is funded by the Department of Health. So, continuing on to look at isolation that some people might be experiencing, it's actually the majority. 1,500 people in Victoria in residential aged care services are the sole speaker of their language in the facility. Even if we look at there being two speakers who speak the same language, those two people may not get along, They may not be able to communicate. There is great isolation, as well as issues in relation how those people, how their needs are assessed and met on a daily basis. And I would say that they probably live a very lonely life in many cases. The facilities that have 20 to 40 or more than 50 people in them make up about 30% of the residents, and those would be what would we probably call ethno-specific services. However, even in ethno-specific services, it doesn't mean that everybody speaks the same language. So, for example, I know that when they were talking about St. Basil's and some of the communication challenges, there were people there who spoke Serbian and Croatian and Italian. So, you know, to assume that everybody in an ethno-specific service speaks the same language is also, you know, is not true. Next slide, please. So what are the challenges? And we've known about these challenges over a long time. One of the things that we know that residential aged care services try to address is to try to hire people who speak the language of their residents. However, if there are 25 languages spoken within the facility, that's quite often, you know, impossible to find a match. There are many staff in aged care services who speak languages other than English. However, their other language does not match the language of the residents, because residents tend to be from the more established communities, while the staff members tend to be from the more newly arrived communities. So that is a big challenge. There's also a lack of understanding or lack of knowledge. There isn't enough research on how good the language skills of the staff who do share the language with the resident. So, for instance, you might have a Greek-speaking resident in a generalist aged care service. You might have a staff who speaks Greek, but we don't know whether that staff member has the skills to carry out the assessments or, you know, communicate effectively with that resident. So those are some of the challenges associated with staff. In most cases, unfortunately, people that are relied on to interpret for people in aged care services are family members. And there is a difference between a family member participating in the discussion about the need for services and what kind of services the elderly person might need, and the role of an interpreter. So, you know, I would like to see the day when an interpreter is there anyway, and if the family member needs to speak to their parent in Greek, that's fine, but the interpreter is there to interpret, and the family member there is there to advocate or support the elderly person with the language that they speak. But in most cases, they're the ones who have all of the say about what the elderly person might need, and there are real issues in relation to that. Use of language services in aged care. So even though TIS National is funded to provide language services to residential age or all aged care services at the time of assessment and service review, even though there is no data, anecdotally, I know that they're not used a great deal. So actually, Monash University has just published a report looking at primary health and aged care translation and interpreting services. It's their project. And they say that professional interpreters were only used in legal situations to communicate with residents with limited English language proficiency. That is unfortunate, because they should actually be used in far more circumstances. Another challenge for aged care services is the lack of streamlined information. That is, they have to go to lots of websites to find bits of information, even though there are websites that are most useful, like the Centre for Cultural Diversity in Aging website, that does endeavour to maintain a repository of resources. You know, more staff in aged care services need to understand that that exists and use that effectively. Responsibility of effective communication is with providers, and I think that the Aged Care Quality Commission has made that clear with their new standards. The new standards are very inclusive and stipulate that, you know, all services should be culturally safe and meet the needs of the individual, and that services provided should be driven by the individual, and that is the responsibility of the provider. So if there's a gap in communication, exploration, and further work needs to be done in that. The last point I'd like to make there is that at present, there is a lack of benchmarking in relation to communication. So we don't know how many aged care services are using language services, how many should be using them, what are the risks of not using them, and so on. So I do think that this work that's being done by Monash, or intends to be, you know, further worked on by Monash University, would be very valuable in ensuring that we start learning what are the dangers of ineffective communication. Next slide. So that brings me to the COVID situation at the moment. I know that when the first wave of pandemic started, it took some time for translated information to become available. Again, like in aged care, COVID-19 information is available on all sorts of websites in different places. So if we're thinking about elderly people who live in their homes or who are in residential aged care, who need to know what this is all about and how to protect themselves and their immediate family, you know, it's very difficult to find the relevant information. Quite often, the information in the language other than English is not clearly linked to the English text. So, you know, providers would quite often not know what is in the translated information. I have always been advocating that all translated brochures should be produced bilingually, 2 pages, of one in Greek, one in English, so that you know, it is clear what, you know, what is being given out. The distribution of information, I think that that has been the greatest challenge and the greatest missed opportunity to communicate with people effectively. I know that Centrelink knows that my mother speaks Serbian. Many years ago, she used to receive newsletters in Serbian. So there is information that's linked to elderly people and to the language that they speak. And so, you know, that's a missed opportunity. There could have been a mail out explaining to the elderly people how safely to wear masks, what is this pandemic about, how to look after themselves, but that has not occurred. I think that in the second phase of the COVID pandemic, the lag in response with translation has been much less. You know, almost immediately the wearing of masks information was available in other languages. And unfortunately, again, how does that get to the elderly? One needs to access the information online, print it, take it to the elderly person, discuss it with them, and so on. So, and it's a really complicated process, and we are relying on the younger members in the community to do that. I will just give you an example of what happened with my mother. Before the second wave of the pandemic, I encouraged her to wear the mask and gloves when going to the supermarket, and she kept telling me she's doing it. And then I said, you know, let's go shopping together one morning. And sure enough, she had her gloves, she had her mask. We were walking through the supermarket. We got out of the supermarket. She pulled the mask down under her nose. And I said, Mum, what are you doing? And she said, but we are outside now. And I said, Mum, you shouldn't be touching your mask. And she again touched it. She kept touching her mask. And I said, Mum, you're not allowed to touch the mask. You have to keep it safe. When you come home, take it off, dispose of it. And she was a bit upset about me being so shocked with her actions. When we got home, they were watching Serbian satellite television. And what was I witnessing with what they were watching? masks were being worn in all sorts of ways and with poor practice. So that was her guide on what can be done with masks. You can carry them in your hand, you can pull it off your face, you can wear it around your neck, on the top of your head. So I explained to her that those messages and what they were doing over there was wrong. So, you know, even use of that media, even though it's satellite television from Serbia or Italy or Turkey or wherever in the world that elderly people are watching, that can be used with health messages that can be done in language and can reach the elderly people who are isolated and need that information. Well, that kind of brings me to the end of what I plan to say. So the next slide, please. So the data that I shared today was in a paper published in 2017, Aging in Australia, Country of Birth and Language Preferences of Residents in Aged Care Facilities, and that's available from the Australian Health Review. So thank you.
Okay, well, that was great, Ljubica. I wanted to thank you for your contribution. And before we move on to Nicholas, we do have quite a few questions. So I wanted to ask you one, are there any examples of what you call and I call good practice? And we don't need to name them, but can you think of anything that we could share with the audience where you know, either an aged care facility or a government organization or a service provider have done correctly or rightly, or, you know, a good example of good communication strategy?
I think a better communication strategy lives with providers who are addressing diversity better generally. Mm-hmm. So communication is not the only thing that they might be doing well. So they're a provider that's reaching out to communities, that has bilingual staff, that's producing information in languages other than English, that's forming partnerships with local communities. So it's the provider that's more inclusive overall that might be doing this better than a provider that merely sees it as, how can we get this out to people who speak other languages? Mm-hmm. Unfortunately, if we look at most of aged care services websites, you know, they do not link to multilingual information, even about themselves, let alone to information that's useful in, you know, in the rest of the world. And yeah.
Yeah, that's a good point. And I think what you've described there is just common sense and logic, really. And from my experience, and I've done a lot of interpreting in aged care in my time, it's usually a person that drives it from within the organization. So someone that actually has a mother or a father or comes from non-English speaking background that really truly understand how hard it is for someone to be alone in a facility and not be able to communicate with anybody. So I'll move on to Nicholas now, and then
can I just make a comment about that?
Yeah, of course, go for it.
Yes, you know, over my, you know, over 20 years of working with the aged care sector, that's what I have observed as well, that quite often addressing diversity has been left up to a passionate individual. And I think that those services are very fortunate to have that passionate individual who drives how diversity is addressed. However, I would not like to imagine what it looks like when that person leaves and goes to work at another service. So that knowledge and their approach is lost. So what, you know, I would be advocating for is that organizations, boards, senior management need to see it as their responsibility and need to be addressing diversity at the most senior levels to direct service provision to ensure that, you know, it is it becomes part of their normal practice rather than an afterthought or an add-on or something that's ignored totally.
Because I guess, I don't know if you agree with me, but I guess we're seeing a lot of structural cracks in what's happening at the moment. Because we've already mentioned, or you've mentioned at the beginning, that you know, we knew this is going to happen, as in terms of numbers and languages. You know, a lot of it was predicted 20, 25, 30 years ago. And we were listening to it, but perhaps not enough was done to ensure that inclusivity or that diversity was being seen as an asset. It was seen more as an impediment or ticking of boxes, all kinds of things in some facilities, I guess. And I think what's happening with COVID, and just everybody listening to the news, we're shocked with what's happening in some of them. And again, it's just exposing those systemic cracks, I guess, is the way I would see it.
Yes, but I do see that I see the world more positively now. In that the new aged care quality standards are very inclusive. They do require providers to think about how they are addressing diversity at all levels of the organization. In the past, diversity used to be considered predominantly with standard 3.8, which was about lifestyle, celebration of a national day, celebration of a multicultural day, rather than, what are the organizational policies? How does the board respond to diversity? How does the senior manager address diversity through their key performance indicators and through their key work? So I think that with the new standards, hopefully we will see a great change.
Speaking of which, we're going to hand over to Nicholas, because guess what we prepared earlier? Go for it, Nicholas.
Yeah, so Ljubica is well placed to talk about the standards because that is what we're covering here. So I just want to go through a couple examples of aged care providers and services out there that are doing the right thing, as Ljubica has mentioned. They're actually actively seeking to benefit their clients and their consumers, as opposed to leaving them in the dark, as so many of the service providers are doing out there. And I want to touch on the Aged Care Quality and Safety Commission first. They're obviously a body that governs what aged care service providers are supposed to be doing. And as Ljubica has mentioned, that standard surrounding cultural safety is a really, really big one. Now, the Commission have taken it upon themselves to cover off that standard internally as well by producing resources in language. What they typically do is a range of different resources, but today I'm just going to touch on a video that we helped them with a few months back. Now, this was with the introduction of the new quality standards, and they came to us with a need to translate a video in English into multiple languages, 25 plus we've got here. So what we said to them is that they need to go through with it properly and do the right things in order to firstly ensure that the message is correct and accurate. Secondly, ensure that it's culturally appropriate, but thirdly, so that it disseminates well and isn't stuck on their website, as Ljubica has mentioned, linked completely elsewhere, hidden amongst the many, many links and pages on their website. So we thought, what better way to do this than to take their video format, have it community approved, translated. So combining both NADI certified translators with secondary checkers, and then involving the community out there with the translation. And now we like to call that a co-design translation. That's something you've heard me and Eva rap on about for a very, very long time. We also added subtitles and voiceovers and on-screen text translated to that video to ensure that we were covering as many aspects of people's literacy levels as possible. It's always really important to consider, because although we are translating in language, it is important to remember that literacy levels are not always going to be the same amongst that community. So now I just want to touch briefly on the outcomes of this. So you'll see here that we've got a view per languages. This is in the first 6 months of publishing that video, and we can just see the amount of views that you get from producing something in language and in a video format on YouTube. So amongst these communities here, we've got 600 plus views, and that's only five communities there. There were another 20 plus communities that we sent this video out to, or developed this video in. So it just goes to show that taking on another format is really, really proactive in the approach for good communication. Now, I might get Andrea to just click into that video. We'll showcase 60 seconds of it just so everyone can get an idea of what that looks like.
Sure. Give me just one moment to do that for you, Nick.
So in the meantime, while Andrea's getting this one up, this is just the example of the Mandarin version for this video that we produced. It's got, as mentioned, voiceover, subtitling, and on-screen text. So it encompasses all of the factors I've mentioned in terms of in format. So it's a really useful guide for any of the consumers that are looking at the new aged care quality standards and getting an understanding on what that looks like. So,
are you able to see the YouTube video?
Yep.
Yep.
If you just want to put it in full screen and play it.
Sure.
您好，我是罗宾，我是质量评估员。我访问老年护理服务机构，并与使用这些服务的人士交谈，以检查服务提供的情况。我的同事遍布全国，我为老年护理服务质量及安全委员会工作，确保您的护理服务达标是我们的工作。那么达标是什么意思呢？我们大都知道什么是优质服务，而且我们希望确保人人都能获得这样的护理服务。政府、服务机构以及社会大众都同意了8项标准，每家老年护理服务机构都要证明自己达到这些标准。标准之一是有关尊严与选择。在实践中，这意味着您的老年护理服务机构了解您，并支持您以自己选择的方式生活。您的老年护理服务机构尊重您的身份、文化以及您做的选择。其他标准指的是您的个人及临床护理。
I might get you to just pause it there. So as everyone can see, that effort of going through video editing process, developing subtitles, voiceovers, it doesn't need to be as difficult as people think it is. It's simply a process of getting the right provider, whether that's Polaron or not, to simply explore that option and develop it for you. So that's something that providers can do in order to maximize their reach and develop good communication streams. I might jump onto the next one really quickly as we are running short on time. And now this is our run-of-the-mill fact sheet translations. This is what Ljubica touched on before as well. In a bilingual format is probably best. I know a few of my clients that we're developing things for at the moment are looking into bilingual a lot more as opposed to your standard developing a fact sheet into another language. Especially in the aged care setting, that's quite important. As Ljubica touched on, there's often interpreters and family members in that setting. So it's really, really good to have a bilingual format developed for your resources. Here's a short plan we did for our care. And now fact sheets are a great way to condense all of the important information your service provider holds and present it to your clients or your consumers in a way that makes sense to them. Greek and Italian, one of the top 2 languages. Here we've done ours in Italian for our care, as you can see in that image there. And what we try to do when we're doing fact sheet translations is preserve the message and the branding of the source text of the source fact sheet for our client. That way they can have resources that they're confident in, will display their message and get their information out to clients in that culturally safe way as well. Fact sheets are also great for fast turnaround times. I know that it may not always be wise to go for a complex video or a complex voiceover project because we simply don't have the time. Given that, it's still important to get that information out there. So if you can't go for the complex project, do opt in for a fast turnaround translation of a fact sheet or some small information. Lastly, I just want to touch on the fact that all of these resources that Polaron produces are NADI certified. It's important to ensure that your translations are not only NADI certified, but maybe even community checked, just to get that safety in terms of the accuracy and ensure that we're not being culturally insensitive when disseminating information. So I might leave it there because I note that there might still be a couple of questions at the end here, and I want to leave it open to a Q&A session as well. But just if you do have any kind of queries in relation to information in your language, disseminating information, getting in touch with your cold audiences, don't hesitate to reach out. We've got a newly appointed business unit manager who is terrific with these sorts of things. So please reach out to either myself, Marie, Eva, as always, is always up for a chat, I'm sure, and Andrea for any sorts of marketing needs that you might want to inquire about.
Okay, beautiful. Andrea, if I could get you to bring up Ljubica's slide with her contact details, that'd be amazing. And I know that I can see that we've got quite a few questions on Facebook, and yeah, there we go. Ljubica, can I just ask you about what your company does? What sort of services do you provide?
So Inclusive Services Australia hopes to work with the aged care sector in supporting them to develop an inclusive approach throughout their organisations in everything that they do. So it's yeah, that's it.
Okay, very good, very good. And I know that there's a lot more to it than just the title. I know you have a wealth of experience and information. So I might hand over to Andrea for her questions, and I've got quite a few here too.
Yeah, so we have one question regarding the video that Nicholas just showed to us. So Gabrielle is asking, in the video, some of the graphics were Anglo-looking. Did you focus test with client group about the artwork and graphics as well?
Yep, perfect. So Gabriel, that is a really good posed question. Firstly, there may not be capability in all design aspects to translate everything. That is completely fine so long as that the information is backed up with what's being said in the video. Now, Gabriel, I'm not too sure if you do speak Mandarin. I definitely don't. But I can tell you for a fact that the English source text does cover off all of the information within the video. So if you are worried about not grasping everything in terms of graphics and design, when opting in for voiceover or subtitling, you know you're always going to get the benefit of covering all the information you need, because when it comes to a script, you're able to put in whatever information is required.
Yeah, I might just add there that you know, there's the perfect world, and then there's the reality of what can be done, and you know, there's people's budgets, timelines, and you know, nowadays producing videos is a lot less expensive. But if you imagine doing this into, I think we did nearly 30 languages with very, very short timelines. There are, you know, I need to be transparent here that some corners that need to be cut, like we will put forward recommendations to the clients. They're not always achievable, but you know, to do it properly, you'd go with the resource to the community and ask them, will this work for you? If this doesn't work for you, be it images, colors, the mode of what we, or the method of dissemination, tell us what will work. So in an ideal world, the community will tell us, you know, and we'll do focus testing and yeah, consultations. But in something like what you've just seen, we were just required, you know, we got the ready-made video. And I think the commission was very attuned to the feedback, but there were some limitations in terms of what we could produce at that time.
Yeah, definitely. I think, yeah, touching on that, time is always of the essence as well. Pulling in an example, not an aged care provider or service provider, but we work with Victorian Fisheries Authority, and they are very keen on doing exactly what you've said, Eva, and getting the time in, going through with consultation. I think where possible, because it's not always possible, we live in a very reactive world where we need to translate information quickly, but where possible, it is important to get consultation of your resources before they are translated. That's definitely a must if possible.
Okay, I have a couple of questions, if that's okay, for Ljubica here, and I'm really pleased to see this question, because I have worked with you on glossaries of aged care terms, and one of our translators asking, and she's worked on both the 2005 and 2010 iterations of it. How come it's no longer available? Is there any chance that this could be got off the ground again, given how much the language that we used to talk about aged care has changed?
I think that the reason that while I was at the Center for Cultural Diversity and Aging, the reason that the glossary was taken offline is because it wasn't updated with all of the latest terminology. As you know, every 5 years or so, there is a great change in the terminology that's used in the aged care sector. So it definitely needed updating. So perhaps that's something that you can approach the Centre for Cultural Diversity and Aging about and see whether there is the potential to update the glossary. I think that even when we consider that 5 years ago to now, there have been so many terms that have changed. And it was a useful resource. And yeah.
So for those people that don't know, this resource was developed for translators, interpreters, bilingual workers, because what we were seeing, and I think Ljubica was really the first person that sort of spoke of it openly, that there was lack of consistency. And I think I remember you talking about a Russian resource where nursing home or hostel or one or the other was translated in 4 different ways on just one page. So that kind of made us realize that every translator that picks up a piece of work or translation will do it slightly differently. So the idea behind it was to create that uniformity across the entire industry, so that anytime any translator translates anything to do with aged care, they're going to pick up this glossary and use the terminology that we have developed. And it was a very robust, very detailed, and it took months, and it was a big headache. But I think we were extremely proud of it. So if it can be taken up again, I think that would be great. The other question there for Ljubica I have is, you mentioned about TIS, and this person saying, my understanding is that aged care is funded for interpreting. Is that right? And why is there such an underutilization of interpreters in aged care?
The funding is indirect, in the TIS is funded to provide language services. But aged care providers are given a code that's their individual client code, which they can use in situations where they need to use language services, i.e. TIS. So by using the approved code, which indicates that they are a residential or a home care service, they would have access to an interpreter.
Mm-hmm. Thank you. Andrea, I can see that you have a couple of questions there, I think.
Yes, we received a question from Ashmina. Some translations sound strange in certain languages due to difference between written or unspoken language. Is there any way to address this long term?
Yeah, I don't know if you know this, but Ljubica is also a translator. She was once. So we both have quite a bit of knowledge about it, and we can talk about translation and how they should be done till cows come home. The reality is that it needs to go through some sort of quality checking process. So you can't develop something in English, give it to a single translator and hope that they're going to do justice to the materials you've developed through robust discussions and editing and approval process, right? So I think in answer to your question, if something sounds strange, first of all, you need to be able to articulate what that means, because it could be your preferences, it could be somebody's style. We need to know, in English, what are you saying? Are they mistakes? Is it some sort of antiquated language that the translators use? It's someone that maybe immigrated from somewhere 50 years ago, and it's not a sort of current language. But I think whatever happens, when you're seeing resources, ask whoever's developed them, who's worked on them? Who? Give me a name of the translator that worked on it. Why isn't our industry more transparent? It really, I'm very, very passionate about that, because firstly, being a translator myself, I can tell you that there's not enough transparency. I know that a lot of work gets sent overseas. And, per se, there's no issue with it. But the reality is that unless these resources are developed for Australian communities, multicultural communities, by Australian translators, there'll always be this disconnect. So, I think whatever the issues are, go back to the person that's produced it, or to the organization that's produced it, and ask them, what did you do? Yeah.
I'd like to also add that quite often people are very critical and realize that text might be difficult to understand or impossible to understand once it's translated, but they actually don't look at their English text critically. Quite often in particular sectors, English text is written with a huge amount of jargon, phrases that don't really mean anything even in English if you really examine them carefully. So that it's writing the information for translation that should be the first step. And I would say that in many situations, unfortunately, people are turning to Google to translate information. I have seen so many examples where people are pretending that they have translated material professionally, while in fact, I can see that it's Google translated and then not checked. Yeah.
So I think personally, I think if you're going to put your name on something, you know, if you're an organization, you do need to have a level of quality checking and quality assurance, and your service provider, whoever that may be, should be able to tell you who's worked on your translations. And I think, you know, working with Australian translators, you know, just like buying Australian made, should be encouraged, because our interpreters, our translators work on the ground. They understand the finer points of translating for local communities. And sometimes you have to adjust that message. I remember years ago when we started talking about dementia in the mainstream. You know, there's a perfectly fine term for dementia in Polish, but people here won't understand it. So we had to come, you know, with a bunch of translators, we had to come to a conclusion as to what word we're going to be using so that the communities here can relate to it a bit better, so that it's you know, part of what translators do is of course education. I can see many more questions. I don't know, do we have time for another one, Andrea?
I think we have one more minute. And I guess for this particular question, you already covered that, Ljubica, but I might jump on that as well. So Lisa's asking, if aged care providers have access to translating and interpreting services via TIS, why do you think there is such a low use of TIS in residential services?
Aged care providers have access to TIS interpreting, not translating. And that's a whole other challenge, where people are given contracts and information about the services they will be receiving in English only. So that's another challenge. I don't know whether it's lack of awareness, lack of kind of acknowledgement that should be done, because quite often people do assume that family interpreting is good enough. They're time restricted. There could be many reasons, but I think that more work needs to be done to encourage the use of language services.
I think on that note, we have to wrap up, but Ljubica, can I just say a big thank you? I'm always so encouraged and invigorated by your passion, and I got a bit hot under the collar, and I'm sorry about that, but it's just, yeah, it's that end user, I guess, if you can put it that way, or the people that are residents or clients or consumers of aged care, or you know, however you want to call them, that I know will benefit from us doing the right thing, that drive me, and I know they drive you. I'm sure that you won't mind if people contact you for further information. I think what you showed us today was very helpful, very, very clearly presented, and you know, it's essentially a business case as to why you should make communication with multicultural communities a given. It shouldn't be anything special. It should be part of what you do, of your daily practice. So on behalf of Andrea, Nicholas, myself, and Polaron, thank you for sharing your information with us today. And we wish you all the best with the new venture of Inclusive Services Australia.
Thank you.
Thanks, everyone.
See you later, guys.
Good afternoon. Bye. Thanks, Ljubica.
Thank you.